This is an epidemic curve. Epidemic curves have three parts: phase 1, phase 2, and an end, phase 3. Each phase is influenced by different things, like infection rate, transmission, and who is most susceptible. This is the start of the curve. Cases pop up sporadically as people who have contracted the virus in one country travel to other countries. Health officials look for people who have been in close contact with someone with coronavirus. This is called contact tracing. Anyone at high risk of having contracted the virus is then put into isolation. The aim is to stay in containment mode for as long as possible, and it allows planning for phase 2, community transmission. And community transmission needs planning because it can get out of control really quickly. It occurs when people who have contracted coronavirus don't realise it and go about their lives unknowingly spreading the virus. The virus outpaces experts' ability to keep up with contact tracing. As you can see, it pushes the curve above healthcare system capacity and the outbreak spreads. And while China has built 2 new hospitals in as many weeks to increase its healthcare system capacity, access to the same resources might not be possible for other countries. The 1918 flu pandemic shows a startling comparison when cities don't implement containment measures fast enough. Influenza first appeared in Philadelphia on Wednesday, September 18. By Thursday, 500 people were sick. Just days later, authorities made a fateful decision. The city did not cancel a parade for the war effort, and 200,000 people gathered for the event. 12 days later, and over 500 people were dead. At its peak, 1,700 people died on a single day. This is Philadelphia's death rate per 100,000 people during the pandemic. Contrast this with the city of St. Louis. Immediately after seeing flu cases appear, authorities moved rapidly to introduce measures designed to promote social distancing. The dotted line is the death rate in St. Louis over the same period of time. This is the difference containment makes. Well, either the outbreak is brought under control or everyone has been infected and there are no more susceptible people left to infect. A vaccine would stop the spread, but that may be up to 2 years away. Washing our hands, avoiding touching our face, and staying away from those that are sick helps flatten the curve, but what we're going to have to do soon is minimise or avoid contact altogether, like St. Louis in 1918 and what China has effectively done in 2020. The biggest weapon is still containment.
All countries can still change the course of this pandemic.